Good afternoon. Welcome to this presentation by the American Association of Colleges of Osteopathic Medicine on Shaping Care Across Communities, Insights from the 2025 Osteopathic Medical Education Impact Report. I'm Dr. Robert Cain, AACOM President and CEO, and I'm joined today by my colleague, Dr. Mark Speicher, the AACOM Senior Vice President for Research, Learning, and Innovation. We hope to accomplish two things with you this afternoon. The first is to spend some time talking about the vision behind the impact report, along with some of the highlights. And the second is to address the methodology used to construct it. Next slide. So let's begin with the vision. Why is the report needed? The osteopathic community is growing. We know the U.S. healthcare system has physician shortages. How much worse would they be if we, the osteopathic community, suddenly ceased to exist? Determining the answer to that question helps us to better understand our contribution to the healthcare system, and therefore our value. The answers also help us to determine what is not easily replaced, such as rural family physicians or a specific type of specialist like psychiatry. The who would care question is in part addressed by the loss of access to physicians, particularly in underserved and rural areas, and the loss of jobs and economic activity surrounding AACOM, or College of Osteopathic Medicine, a number of which are located in economically challenged areas of the country. Why is the report needed now? Growth has changed our position in the healthcare system. We are more visible than ever. AACOM is committed, as part of its strategic plan, to elevating the voice and influence of osteopathic medical education. Accomplishing that means having more than anecdotes and our beliefs when advocating and telling our story. It means having good data to act upon. Next slide. The Workforce and Economic Impact Report is the first of two reports to be published showcasing osteopathic medical education's contributions to the U.S. healthcare system. The second report is focused on the research happening at our colleges of osteopathic medicine across the country. Life-changing, community-altering research is occurring on our campuses and in partnership with others. Understanding the scope of that research helps us to advocate for additional funding at the state and federal levels, and to tell the story of our contribution to the U.S. healthcare system. As first editions, these reports will serve as foundations to build and improve upon in the future. Dr. Speicher will talk more about the soon-to-be released research report later in this presentation. Next slide. The impact report tells the larger story of osteopathic medical education. It highlights how graduates of AACOM member colleges are supporting communities with the greatest health needs by serving in primary care, rural medicine, and medically underserved areas. And it also provides the reader with an opportunity to learn more about how osteopathic medicine is strengthening the physician pipeline and fueling economic growth in communities across the country. Next slide. So let's review the goals one more time. Strengthening AACOM's thought leadership to demonstrate the importance of osteopathic medicine. Leading a national narrative that showcases the value of osteopathic medical education and the DO pathway. Equipping key audiences with assets to advance opportunities for osteopathic medical education. Enhancing relationships with colleges of osteopathic medicine, students, and researchers. Creating a demand for AACOM research and information from key audiences. And finally, creating a pipeline of contacts and data points for future reports. These points are important because they serve to draw attention to the DO education pathway as a preferred pathway to practice and as a solution to the nation's healthcare needs. Next slide. Anecdotally, we've long known about how our community supports local businesses, health-related programming, and other opportunities that engage and add value to the lives of residents surrounding our medical schools. This analysis sought to capture and quantify the impact of our community's investments in localities across the country. Our schools are creating real jobs and spending power in communities as a byproduct of medical education. Across the country, COMS generated $6.2 billion in economic output in fiscal year 23. AACOM schools directly supported more than 20,000 jobs, paying out $1.3 billion in wages, salaries, and benefits. In total, COM supported nearly 40,000 jobs, or roughly 700 jobs per COM, and contributed $3.3 billion in GDP across the U.S. For every 100 direct jobs created by COMS, 84 additional jobs were indirectly supported in other industries, including finance, education, and hospitality. Dr. Speicher will address how this was determined in a few minutes. Let's keep in mind that many of our COMs are located in underserved and rural adjacent areas where good jobs are needed. Next slide. Our distributed, community-embedded model of clinical education provides additional impact. Even in states that have no osteopathic medical school, there's economic and workforce value generated. As an example, Massachusetts has no COM, but the state still benefits economically, calculated at $15 million in economic output. I've already mentioned that the median level of impact among the member institutions is 745 jobs, generating $39 million in labor income and $54 million in GDP. Next slide. There's a national shortage of physicians threatening the U.S. healthcare system that's resulting in care that is ineffective and costly. The shortage compromises quality and affects health outcomes. Using one model, by 2037, the United States will have a shortage of as many as 187,000 physicians, inclusive of more than 80,000 primary care physicians. These shortages will most acutely impact rural and underserved communities. Osteopathic medicine is one of the fastest growing segments of healthcare, representing nearly 30% of the nation's medical students today. Since 1990, the number of practicing DOs has more than quintupled, from 30,000 to 160,000 in 2025. These numbers mean that our graduates are an important part of the solution to our nation's physician workforce needs. With the 73 campuses offering the DO degree, without the 73 campuses offering the DO degree, the shortages would be worse. Next slide. Our graduates have a long history of serving in primary care fields. Historically, about 25% of graduates from MD granting medical schools work in primary care fields, according to the AMA in 2025. Our data show that 56% of COM alumni practice in primary care specialties, which includes family medicine, internal medicine, and pediatrics. And an additional 25% of COM graduates are in fields that often supplement or support primary care, like psychiatry, OB, general surgery, and emergency medicine. Next slide. COMs are consistently recognized for producing high numbers of graduates serving in primary care, rural medicine, and in underserved areas, despite accounting for just 22% of all accredited medical schools. Of all the COMs analyzed in the study, every school had more than 45% of its graduates practicing in primary care. Contributors to this include osteopathic training, heavily emphasizing whole person care, a selection process, the medical school mission, and the medical school location. It's important to keep in mind that, according to AAMC data in 2025, fewer than 5% of medical students come from rural areas, and just 11% of physicians practice in rural areas, despite 20%, or nearly 50 million people, of the U.S. population living in rural areas. This report suggests that 12% of COM alumni serve in rural areas and 16% in medically underserved areas. Depending upon the COM, these numbers may exceed 30%. Osteopathic medicine has long valued service in rural and underserved communities, and they demonstrate this accordingly. 56% of COMs are located in health profession shortage areas, and 64% require clinical rotations in rural and underserved areas. One important point we don't want to overlook is retention. 38% of COM graduates practice in the same state that they received their medical training in. Having a COM in your state adds to the physician workforce. Next slide. You can learn more about this work on our website and navigate to all our resources, including the 2025 OME Impact Report, a national brief, stories and videos from our community, and promotional materials. Let me summarize the first part of this presentation by saying that COMs develop programming that jointly supports medical education, offers beneficial health services to community residents, and allows students to build relationships with local communities. As our values permeate across the American healthcare system, osteopathic medicine is making a difference in how Americans think about health through a holistic, whole person lens, and how they experience care through compassion and the use of touch to both diagnose and treat. Now, I'm going to turn things over to Dr. Speicher to provide more details about the report. Mark?
Thanks, Dr. Cain, and thanks to all of you for joining us today to hear about this important work. Next slide, please. There were two key areas of this report that capitalized on AACOM's data and that we worked closely with Ernst & Young, our partners in this report, to ensure a full picture of the contribution that our colleges of osteopathic medicine were making to the U.S. and to the U.S. healthcare system. Our annual survey data served as the backbone of the workforce data sources for this report, and we incorporated American Medical Association physician professional data from their dashboard and from their physician professional profiles. We reviewed data for more than 143,000 practicing osteopathic physicians, and we included every College of Osteopathic Medicine that had an inaugural class by the year 2017. We grouped these physicians by practice location and specialty to determine the workforce impact that our colleges are making. Additionally, our survey data, supplemented by the U.S. Department of Education IPEDS, or Integrated Post-Secondary Education Data System data, served as the key driver of the economic impact analysis that included spending on instruction, research, and payroll, as well as other factors that I'll discuss more completely. Next slide, please. The economic impact component used IPEDS data, which is a system of interrelated surveys conducted annually by the U.S. Department of Education's National Center for Education Statistics, as well as AACOM's annual survey that each year has 100% response from our colleges of osteopathic medicine. When we talk about the direct economic impact of COMs, what we're talking about is economic impacts resulting from job creation, from wages and contributions to GDP, and from other information included in this report. When we talk about the indirect economic impact of our colleges of osteopathic medicine, what we're talking about there is the payments that COMs make to suppliers, purchasing goods and services in the region, and other economic impacts that are outlined more completely in the full report. The induced economic impact is COM employee spending, economic impact resulting from the employees of COMs spending both inside and outside the region. The economic models database constructed by Implan is a widely used model throughout the United States to look at and value the economic impact of institutions like colleges of osteopathic medicine. Next slide, please. We spend a lot of time at AACOM doing workforce analyses and analyzing workforce data. Whenever data is analyzed, the researchers who analyze it make decisions about how to count and place physicians geographically and what that means. We used data on enrollment, graduation, and specialty of practice, as well as location of practice to map the physicians that graduate from our colleges of osteopathic medicine. We used the most conservative Health Resources and Services Administration, or HRSA, definitions for the shortage areas that we discussed in the report, which include health profession shortage areas, medically underserved areas, and rural areas. There are many ways to define these areas, which can give you many different results. By using the most conservative or narrowest definition, we made sure that we were reflecting the actual experience of patients who, in rural areas especially, may have to travel long distances for care. Additionally, we had to choose definitions, and we chose the narrowest definition that the U.S. government uses to determine funding eligibility for health professions shortage areas. We were only able to include data from schools that had graduates, and because of the incredible growth of osteopathic medicine and osteopathic medical education, this did not include many of our newer schools. If you look at the growth in osteopathic medicine since 2022, we've grown by more than 24%. Every COM that we looked at had more than 45% of their alumni practicing in primary care. And overall, that proportion was 56%. An additional 25% of our alumni practice in primary care specialties that commonly supplement or support primary care, like pediatrics, obstetrics and gynecology, and psychiatry. These conservative definitions mean that we were more likely to understate, but never overstated, the impact of osteopathic physicians in rural areas. Next slide, please. I'm going to turn it back over to Dr. Cain to talk about how osteopathic medical education is shaping the health and well-being of our communities.
All right, thank you, Mark. And important to know how we accessed and decided to use this data, right? So that we're hopefully sharing it most effectively. So I am frequently asked this question: why is osteopathic medicine growing so fast? Among others, there are likely several contributors. The philosophical whole person approach to care resonates right now and is increasingly desirable. COM locations are growing in number, making us more visible. And the COM mission and priorities are important, including the focus on rural health and serving the underserved. Let's take a moment, though, to talk about healthcare in distress. And I'm not talking about today. For us, that moment actually begins in 1892. Our founder believed that we needed another way to teach and practice medicine, and that we were already losing sight of the person in front of us more than 130 years ago. We remain committed to that original human-centric framework that heavily emphasizes, the importance of caring for the body, mind, and spirit of each patient and achieving functional outcomes over simple symptom management. And it took time for this community to have an impact. The difference now is the reach of the osteopathic community. We have grown from that single leader, single school, and 21 students to the numbers that you see here. More than 40 COMs are operating in more than 70 locations across 36 states. Nearly 40,000 students are earning the DO degree. We were born of necessity during a transitional time in medicine, and our approach to the practice of medicine is more necessary today than ever. Next slide. These four inspired goals are the guiding stars for AACOM as part of our strategic plan. Reimagine recruitment and admissions to find students who want to grow the vision. Strengthen our community of role models to support them as they support our students. Develop an ecosystem supportive of osteopathic education to assure our students have opportunity to fully develop an osteopathic mindset and apply it to patient care. And we are always looking for partners who want to help us do that. And finally, strengthen osteopathic representation, voice, and influence. This report is a specific example of our effort to address voice and influence. Next slide. So let's talk about voice for a moment. AACOM is addressing priorities for the osteopathic profession to support our growing community and to help transform the future of American healthcare, allowing the communities we serve to live healthier lives with a greater sense of well-being. I want to mention the Community Teams Act. This is an effort by AACOM to establish a new HRSA grant program for medical schools, both DO and MD, to increase support for clinical rotations through partnerships with healthcare facilities in medically underserved areas. And finally, you can use your voice to help us advance this measure and others by participating in events like our annual Advocacy Day. Next slide. So I want to repeat that this is a foundational report. We intend to build upon it in the years ahead, likely on a triennial basis. Additional materials will be added over time on our website. Mark, what would you like to add about the research report?
Thanks, Dr. Cain. Many of you already know that our colleges of osteopathic medicine are doing incredible research from the bench to the bedside, and there isn't really a good summary of all the research being done at our comms. We've undertaken over the past year, with the support of the Osteopathic Heritage Foundation, a research inventory tracking all the current extramurally funded research at our colleges of osteopathic medicine. From that research inventory, we have developed a searchable database for active research and recent publications that can be used by community members, by students or potential students, and by other researchers to explore the research going on at each of our colleges of osteopathic medicine. This will facilitate and promote collaborative research between our colleges and in communities where research is sorely needed to deliver the most groundbreaking care to the patients that our students and faculty and osteopathic physicians care for. So we look forward to unveiling this report at Educating Leaders 2026, the AACOM annual conference in Las Vegas, Nevada on April 21st. Thanks, Bob.
So it should be really exciting for this community to have access to that information and have that much better sense of what's happening in terms of research across all of our colleges. Next slide. Well, I want to thank Dr. Speicher for joining me today and all of the AACOM team who contributed to the development of this report and bringing the webinar together. I especially want to thank our Strategic Communications Manager, Radhika Hira, for whom this has been a labor of love. We appreciate the work that's gone into this. It was exciting to watch the report develop and then see it be released for public use. You can use this QR code to access more information. Thank you for joining us. I believe we're now going to try and address a few questions from attendees.
Dr. Cain, I see a question in the chat, and I'll pose it to you. and then I'll jump in a little bit as well. How does AACOM propose to increase the number of OMM or osteopathic manipulative medicine teachers to meet the demand of all the new comms and locations opening up? How do we ensure that our profession remains osteopathically distinct if we don't meet this demand?
Yeah, it's certainly an area of interest to us and an area of concern that we'd like to see those numbers increase. We are actually proposing a special working group between the council at AACOM that focuses on advancing osteopathic principles in practice and the directors of osteopathic education from the GME community that oversee osteopathic recognition programs to look at the continuum of the osteopathic medical education experience and look to identify ways that can increase interest in that particular specialty, as well as addressing how we better integrate osteopathic principles in practice in terms of especially the use of OMT and OMM across all specialties, right? We think there's great opportunity there, especially as we begin to see this shift in the healthcare system towards more prevention and emphasis on whole person care.
I just want to add, Dr. Cain, that we've been working with the Society of Osteopathic Medical Educators on some faculty development for new faculty, but that also extends down into our recent graduates and our students. If students and graduates can see a clear path to becoming a faculty member at a college of osteopathic medicine in OMM and in other areas, we believe that that will not only strengthen the education that our students are receiving, but strengthen the osteopathic profession as a whole.
Yeah, the other thing I might add, Mark, is if you think earlier, one of the slides, I showed the four inspired goals that are part of our strategic plan for AACOM. And one of those addresses role models. And so I think the idea of making sure we have good, strong role models that our students are able to see as practice pathways towards neuromusculoskeletal medicine, as well as integration of those same principles into other practice will help to address the question that's being asked as well.
Radhika, do we have any questions in the Q&A?
Yes, we do. So we have one question looking at the difference between definitions in rural health and how that might have impacted our findings. So, Mark, would you be able to answer that?
Absolutely. As I said during the session, we used the most conservative possible definition of rural that's used by HRSA, the Health Resources and Services Administration, and by other government agencies when they're looking at funding rural health initiatives. The advantage of using this is it reflects patients' actual experience. If you live in a rural area, those of us who have lived in a rural area, you know that driving a long distance for healthcare is both commonplace and detrimental to health. It discourages patients from seeking care, and sometimes the wait times actually contribute to poorer health outcomes. So by using the most restrictive definition of rural, we are actually looking at just the physicians who are providing care to these patients who are in the most rural areas. If you expand that definition, and there are less conservative definitions, so that includes small communities under 50,000 or those kinds of definitions, then an even larger proportion of osteopathic physicians are providing care to those patients. We used the most conservative definition so that we wouldn't be accused of overstating the number of osteopathic physicians who provide care in those rural areas. But we're working on a white paper that we will share as one of the resources for this report that looks at a number of different, less restrictive definitions and the proportion of osteopathic physicians that are providing care in those less strictly rural areas, but still areas that are underserved by the healthcare system.
Thank you, Mark. We also have another question. It reads, with the pool of candidates diminishing in applications to graduate programs, including comms schools, how do we balance increasing the number of comms versus the decreasing number of qualified medical student applications?
So let me see if I can try to answer this one based upon what's happening and what our efforts are at this point in time. So AACOM has had a banner year in terms of applicants to its centralized application program. We think that increase is multifactorial. I addressed some of them earlier in the presentation, including simple growth of the profession and presence. But we have also been aggressively undertaking marketing work to increase awareness of osteopathic medicine across the United States and more broadly for students. We've been trying to work with health professions advisors more directly so that they see this as a pathway to practice for students. And we continue with our undergraduate medical education services team to offer multiple events throughout the year, including right now an 8-week series of webinars to help people see and learn about osteopathic medicine. So while we understand some of the demographics that exist, we also think that we have great opportunity at this point in time to better help people understand why this might be the preferred pathway to practice for them and can continue to see adequate numbers of applications to meet the needs of our growing colleges. Mark, do you have anything you'd like to add to that?
I just think that we've seen a couple of years now of applications that outpace the applications for MD schools or for other health professions, and I think that's just an indication both of the great job that Dr. Cain you're doing in leading our organization, but also the team inside the organization that is really focused on reaching students who want to be great osteopathic physicians and helping them come in.
Great. And we have one other question. Has ACOM considered sharing its data regarding our students and graduates to help promote graduate medical education and workforce development within states? And also a comment about how close partnership within states could be a win-win.
Bob, if you don't mind, I'll address this question.
Sure.
We encourage researchers and others to use our data. In fact, we have a very open data sharing program. If you go to I'd encourage you to go to once you've looked at the resources for the impact report, I'd encourage you to go to our data and reports page and look at some of the reports that you can see going back, more than a decade, the growth in osteopathic medicine, the growth in applicants, the growth in schools. They're all documented by reports on that page. We also have data regarding the specialties and the areas that our students match to. If it's not already in a report that you can share inside your own state, please go down to the bottom of that page and click on the link that takes you to a data request form, and we'd be happy to share data with you, whether it's for research or for the development of GME programs. We love sharing data and we love doing collaborative research.
And I would add, specifically the way this question was asked about within states. Interestingly, one of the reasons this report came to be was actually seeing similar data from individual states. And I thought, well, if we can see that for an individual state, why don't we try to show that for the entire country? And then make that available exactly as the question is asking, so that individual colleges could use that within their states or within their regions to be able to advocate for additional resources and things that can help them to contribute to the workforce and ultimately to healthcare delivery. So we'd like to think, as Mark is going through the details of what's available on our website that we can draw more people to AACOM's AACOM.org website in order to be able to access and use these materials as part of the conversations that take place about improving healthcare delivery.
That's a great point, Dr. Cain. And if you're reading the report and you scroll down to the end to some of the appendices, you will see both the economic and the workforce impact for each specific state outlined at the end of that report.
Yes.
Those are all the questions that we have right now. If anyone has any last burning questions, please let us know. Oh,
So
and look
please,
at
you can
that, we
reach.
have another one. Have we extended our undergraduate efforts to high school seniors going to college to get to know about osteopathic medicine?
This has been an exciting development, I think, to watch the individual schools work further into the education system, so backward into the education system. So instead of simply reaching out to college students and trying to recruit them into medical school, developing programs that reach back into high school and junior high in some cases, starting to get people interested in what does a healthcare education look like, and then ultimately helping them to understand what osteopathic medicine is about, and again, potentially seeing that as a pathway forward. AACOM in the past has had some programs as well that were directed to younger learners, trying to interest them in the same. So I think this is a space that you'll continue to see growth in the future as we try to treat this as a pathway to practice and not simply a conversation that begins in college. All right. Well, since I don't see any more questions in the chat or in the Q&A, certainly if there are other questions that come to mind, please reach out to us at AACOM. We'd be happy to try to answer them for you. But thank you again for attending today, and have a wonderful rest of your day.